Hi, my name is Jerry Nunn. I'm the owner of Nunn Better Health and Wellness in Lake Placid, Florida. Here to tell you a little bit about myself and about this CBD. My experience as a pharmacist, over 30 years of hospital pharmacy. I was director of pharmacy in three hospital systems in Fort Myers. I was also director of pharmacy of a 2-hospital system down in Naples. I was director of pharmacy of a teaching hospital up in Philadelphia. I'm also the only pharmacist in the state of Florida that has a cannabis certification from an accredited university. I am a licensed pharmacist. I'm also a licensed consultant pharmacist. I have a certification in pharmacogenomics, and I'm also on the State Florida Hemp Council. I wanted to tell you a little bit about why I'm in the CBD business. I'm a very big water skier. Love to water ski, very active, big weightlifter. And one of the things that has happened with me is my knee has become bone on bone, so I'm needing a knee replacement. I found that out about 4 years ago, and I was actually scheduled for surgery up at Johns Hopkins, and I started looking at the life expectancy of a knee replacement. It was about 15 years. I didn't want to have a revision later on in life, so therefore I went ahead and started trying other alternatives. At that time, I'd come home from work, my leg would be like a mini watermelon, extremely swollen, tremendous amount of pain, a pain scale of about 9.5 out of 10. I was on meloxicam, which is one of the pharmaceutical non-steroidals, and it just absolutely wasn't working. And so I started this CBD because I did not want to have the surgery. And the CBD has absolutely changed my life. And that's one of the reasons I'm so passionate about it, is because once I started taking the CBD, it took about 2.5 to 3 weeks for the internal oral to start working. But when it started working, it was amazing how it decreased my swelling, decreased my pain. So I went from a 9.5 out of 10 pain scale down to about a 1.5. Able to still actively water ski, which is my passion. I love it, and it was a huge difference. And from that, I've developed some CBD products. They're Pharmacist formulated, and I really wanted to make sure that they weren't just another product out there on the shelf, but actually the differences in the product. And I have some roll-ons that are outstanding as far as for muscle aches and pains, arthritic pain in the knee, the back, the shoulder. It's been amazing. The oils are very good, high quality, super critical CO2 extraction process, very clean. The majority of my oils have no THC. I do a lot with law enforcement, do a lot with hospitals and schools, and you cannot test positive. And so my broad spectrum products do not have any THC. And from a quality standpoint, I have the certificates of analysis or the lab analysis to be able to back those up. Very, very proud of those. Anyone that's not wanting to show you their certificates of analysis are readily available online, then I would be hesitant to want to buy that product, because you should be very proud of the product that you're producing. I'm not going to name the companies that I tried. I've tried multiple different companies. One of the things is the taste. A lot of them use the hemp oil for their carrier agent, and the hemp oil is an antioxidant. It doesn't have any CBD in it. Hemp oil does not have any CBD. It has antioxidants. It's like taking fish oil or vitamin E. However, it has a significant taste, or a taste that you won't forget. We use MCT oil. It's much more bioavailable, absorbed into the body, and it also has a much cleaner taste, and so it's much more tolerable. There's a lot of people that when they taste the CBD, that really turns them off because of what it tastes like. So many people, they doctor their product by adding different flavors to it to try to cover the taste. The reality is, if it's a good, clean product, you don't need to do that. What sets me apart from other products out there, and actually from myself, as a pharmacist, I'm really a true clinician, and I deal with patients all the time. I have a tremendous amount of referrals from physicians. It's like, why would a physician refer to me? One of the reasons is that a lot of physicians, they have patients that have serious back pain injury, serious knee pains, and their own opioids. And the doctors, obviously with the new DEA regulations, they're very hard to be able to write for, and without going through a pain management consult. So a lot of doctors refer the patients to me because they don't want them on the non-steroidals like meloxicam and naproxen, because it's very hard on the kidneys. They come to me, I do an evaluation of the patient, make sure they're not on any anticoagulants. which we can go into later. But the most important thing is that the CBD with the right dose will absolutely help a tremendous amount with the inflammation, which helps to reduce the pain. And it's amazing the results that we've seen with a lot of patients. They come in there, they were on high dose opioids, and being able to reduce those down to practically nothing. It's been amazing. Less side effects with the CBD compared to the opioids. You don't have all that constipation, other issues that the opioids do have, obviously with the addiction properties. And people are so much happier, their lives are much better. The quality of life is so much better with the CBD over having to take the opioids. So the doctors refer a lot of people like that. Another reason is people that are in so much pain, they're just taking a lot of over-the-counter Advil or ibuprofen. And again, that's a non-steroidal that is for pain, inflammation. However, it's 100% metabolized through the kidneys. As we get older, your kidneys function goes down, so it's very, very hard on the kidneys. And so they're trying to do another alternative, which would be CBD, which helps even better with the pain and inflammation, and it's 100% metabolized through the liver, and it doesn't have that kind of side effect. And it's been very, very successful for a tremendous amount of patients. And I'm very happy. I follow up with all my patients, make sure how they're doing, and it's extremely rewarding as a pharmacist and the profession to see how well it's working for a lot of people. It's just awesome. One of the things I was wanting to talk about with regards to the CBD, why do patients come into to the office? I keep calling it a pharmacy, but it's an office with the storefront. And one of the big reasons is for pain. Tremendous amount. I deal a lot with people over age 50, a tremendous amount of people that have all sorts of pain, whether it's shoulder pain, joint pain, muscle pain, back pain. It's really significant. And the second thing that's really significant is the people that have a lot of stress and anxiety. Even though the CBD product is not for blood pressure, as far as it doesn't actually reduce blood pressure itself, it does help reduce the stress. And so if you're able to reduce your stress, you're able to reduce your blood pressure. And a lot of people that are on it as an adjunct to their current medication with blood pressure. As far as with the pain, tremendous amount of people walking in with back pain. I treat so many patients that have major back pain. They've had multiple scars on their back. I have a roll-on that I roll on their back, and it's amazing the way that it works. And literally within 20 to 30 minutes, they're getting significant relief in their back. When they've had major surgeries, they're on some of them on serious opioids, muscle relaxers, things like that. And the CBD has really helped to eliminate a lot of that at the right dosing. The other thing that's important, when you walk in the store, I have a 60-inch TV monitor that when people come in, they say, well, I bought this off of the internet. It doesn't really seem to be working for me, a CBD product. And can you look at it? The first thing I do is I pull it up online. In front of them on the 60-inch screen, we go right to the manufacturer's website. The first thing I look for is the certificate of analysis or the lab analysis that shows what's actually in that product. Regardless of what the label says, you need to know what that third-party lab analysis says. And it's amazing how some of them really do not have the quality of CBD that you need to have, and actually that's required in the state of Florida now. It's amazing. A second thing is, when we're looking at it, I identify that the dose that they're taking, they're getting a very, very low dose, but they're treating massive arthritic pain, knee pain, and back pain, and it's not enough. And so we're able to adjust their dosing based off of the patient's condition, their weight, their age, and based off of what other medications they're on to make sure that it's optimum for them. Another thing that's extremely important is there's one drug interaction. There's different drug interactions because it's 100% metabolized to the liver. So there's other drugs that are 100% metabolized to the liver. So therefore, there is interactions. However, the number one drug interaction is with blood thinners. When I'm talking about blood thinners, I'm about serious blood thinners like Coumadin, warfarin, Xarelto, Eliquis, and those are 100% metabolized to the liver. So therefore, there's a drug-drug interaction, and they fight for that metabolism, and it increases the levels of the blood thinner in the body. And so there's a higher potential for a cerebral bleed, a GI bleed, could be very significant complications. So it's absolutely one of the screening processes that I use because the blood thinners have such a very narrow therapeutic index. Just a little bit of change can make a dramatic difference in your bleeding times. On our manufacturing process, we have a facility out in Colorado. They grow all their own hemp, and then that process is then they pull it off the fields. It goes to the extraction facility. The extraction facility, we do what's called supercritical CO2 extraction. That's the gold standard in the industry. It's also the cleanest in the industry. That's why you don't get all the significant different taste that some of the products have in it. And then from the extraction facility, we get what's called an isolate and a distillate. And then from that isolate and distillate, they get sent to our other manufacturing facility that then goes through the process of being able to formulate it. That's where the art is, as far as when you're mixing the isolate with the distillate that has the other ingredients in there to come up with the proper formulation that we want to have. And it's very, very precise, and very, very proud of that. And our certificates of analysis back that up. No pesticides, no herbicides, no heavy metals, all of those that are required in the state of Florida now to make sure that they do not have any of those contents is extremely critical. And again, very, very proud of these certificates of analysis. And again, I cannot emphasize enough, it's all about quality, and quality is held with that certificate of analysis. It backs up everything that we say, and it makes an absolute difference. And in the state of Florida, all of that is required now. As of January 2nd, it became formalized to where they're enforcing that throughout the state. And any other CBD company in the country that wants to come into Florida, they have to abide by those rules. In addition to the labeling requirements are completely different as well, much higher standards, and very, very proud of those. It's a higher quality. And being on the Florida Hemp Council, I'm very proud to be a part of that. I'm Jerry Nunn. Thank you for trusting Nunn Better.